This is Healthcare Bill Part Number 41. This is other provisions, Section 1251, preservation of right to maintain existing coverage. It says no changes to existing coverage. Now, I've read the paragraph here. Basically, what this is saying, from what I can interpret here, okay, let's say before this healthcare bill became a law, you had X and Y coverage, okay, from your employer. All right. Well, when this bill became law, you didn't have to stop your coverage all of a sudden to get a new health plan from your employer. You could have kept right on with it, and if they wanted to renew it, and you wanted to renew it, keep right on with it. Whatever you had, you could actually renew. And that's what they were talking about in the second paragraph, was you can continue on until the employer says, okay, we got to change the plan. So, allowance for family members, okay? Let's say you're in a current plan, this thing became a law, you can still enroll your family members into your old coverage until your employer requires you to do something different. This works with unions usually, okay? Unions will negotiate a multi-year contract with a health insurance provider. And until that contract is up, you get X and Y coverage. Now, if somebody else was hired after the time that this thing went into effect, they would have to be given a new plan. Okay? But the ones who were already working when this thing got thrown in there, their plan continues until the next contract. So that's what I get out of this. This has an effect on collective bargaining agreements in the case of health insurance coverage maintained pursuant to one or more collective that was ratified before the date of the enactment of this act. The provisions of this subtitle and whatever shall not apply until the date on which the last of the collective bargaining agreements relating to the coverage terminates. Any coverage amendment made pursuant to a collective bargaining agreement relating to the coverage which amends the coverage solely to conform to any requirements added by the subtitle shall not be treated as a termination of such collective bargaining agreements. Okay, so basically what they're saying is that whatever you agreed to prior to this thing getting thrown into law, that continues on, all right, until you have your next negotiating session, and then it changes. Okay. Section 1252, rating reforms must apply uniformly to all health insurance issuers and group health plans. Any standard requirement adopted by a state pursuant to this title, or any amendment made by this title, shall be applied uniformly to all health plans in each insurance market to which the standard and requirements apply. The preceding sentence shall also apply to a state standard or requirement relating to the standard or requirement Okay. This subtitle and amendments made by this subtitle shall become effective for plan years beginning on or after January 1st, 2014. So basically, Section 1252 says, if we're going to make a regulation for one health insurance company, we have to make it for everybody. We can't just single out a single health insurance provider. Wow. Guess you're getting a lot out of this tonight, aren't you? Alright, I'm going to tell you more in my next video, so stay tuned.